we're very excited to talk to you about a problem and our solution to that problem. Every year, there are over 1.5 million medication errors in hospitals and long-term care facilities, resulting in 90,000 injuries and 15,000 deaths, costing healthcare providers over $12 billion annually. That's the monetary cost. What is the value of a life? Each medication error can occur in one step in the process of the medication administration. As you can see in this slide, half of errors occur when a doctor prescribes that medication. But due to controls that exist via the pharmacist checking before they enter the medication or the nurse rechecking it before they actually administer it, the actual results that reach, or the errors that actually reach the patient is remarkably different. We're going to focus on this half of the medication errors where a nurse may make a mistake when she administers that medication to you. She may give the wrong drug to the patient, or maybe give a drug to the wrong patient. It may be the wrong time, maybe the wrong dose, it may be the wrong route, such as administering an IV instead of a pill. To solve this problem, the industry has come up with a methodology to solve these errors. Looking at the right patient, and it's called the 5 rights of medication administration. Checking the right patient, the right drug, at the right time, the right dose, and via the right route. Before computer systems existed, this was done completely manually with a checklist. While a checklist is better than nothing, it's very easy to make an error when you have 60 patients that you're administering drugs to 3 to 4 times a day. Other than insulin injections, there's also very little verification that the nurse actually performed those checks. And with high turnover, there's less skilled staff that may commit errors a lot easier than people that are very skilled. In the last 10 years, barcode medication administration systems have entered the market to help facilitate and automate this process. So a nurse will scan a barcode on a wristband and then scan the barcode on a drug, and the system then verifies those 5 rights. Unfortunately, less than 25% of hospitals and a far less percentage of long-term care facilities have implemented this type of system. There are several reasons for this. The primary reason is it's just cost prohibitive for a majority of small and rural hospitals and long-term care facilities that simply don't have the capital to invest $300,000 to $1 million of implementation fees for one of these systems that exist. In addition, because they're focusing on hospitals, these vendors and these products are tailored to that hospital workflow and may not match the workflow of a long-term care facility. We believe that the long-term care market has the biggest pain, and that's who we would like to target with our solution. Over half of the medication errors that occur in long-term care facilities. They also have one of the highest turnover rates, resulting in unskilled or less trained nurses who may commit an error a lot easier, as well as overworked clinicians. In addition, these long-term care facilities just don't have the budget to spend $300,000 to $1 million for one of these implementations, nor do they have a dedicated IT department to support one of these implementations. This market it's a great market, it's a great opportunity. With 16,000 facilities in the US, long-term care facilities and long-term care revenues totals $175 billion, which is only going to increase with the aging baby boomer population becoming retirees and maybe going into long-term care facilities. In addition, this is a very fragmented market, which means most of the facilities out there aren't part of a big corporate chain that can afford one of these current systems that exist. In addition, there's $70 million in the healthcare legislation that was passed in the spring that is dedicated for long-term care facilities to spend on IT systems. We believe this is a great opportunity. We believe we have a product to solve that problem. I'm going to hand it over to Marty to talk about that.
Thank you, Thomas. So our product, what is ScripScan? ScripScan is a software as a service solution that's delivered on a mobile device, much like this. And it is made for the whole process of administration of these medications, drugs. As you can see from these 4 pictures here, screenshots, these are screenshots from an application software that we built this weekend at 3DS. And so the first one is what it would look like on the home screen. The second one is the login screen to comply with all of the HIPAA regulations. On each one of the devices, it will require a login, and if the application is closed or the device times out, the individual would have to log in again as well. The third right here is a listing of the patients that that nurse practitioner would be in charge of delivering medication to. So they will have a summary of all of their patients. And the last one here is their profile. And as you can see, the administration, the check mark on the left, the medication list on the right. We deliver an electronic e-mark as well, and a print function. So what does this actually do? You may be asking, well, so what? What does that actually do? What this does is pretty simple, but pretty magical as well. Because what we do is we ensure the 5 rights. We have a photo confirmation. The drug barcode scan is incorporated within the software as well. So they can not only verify the person, that it's the right person, but also the right medication as well. The right time of admin, the dose, and the route as well. We do have drug-specific checklists as well, because some medications, the resident cannot take it if their heart rate is above, say, 160, or they haven't eaten in the last hour, so that part is covered as well. Now we're going to be 100% HIPAA compliant as we launch as well. Now this is where ScripScan fits into the market. This is kind of where the value add of ScripScan actually is. Long-term care facilities, the pharmacy where they get all of their medications delivered from. ScripScan right there with our rack space hosting kind of in the cloud or that provider. The internet's right there in the middle, and all of the data going to and from each individual is encrypted as well to comply with HIPAA. 3Day Startups has been amazing, and we did some very unique primary research and market research as well as some secondary, and there are ferocious pain points that were that were uncovered, and one of the biggest ones is errors. And so what we've done is we've designed the product to those pain points. So reduced medication errors, lower total cost of ownership. As Thomas had stated, that these long-term care facilities cannot afford $300,000 to $1 million. So what we do is we do a monthly subscription fee, managed hosting tailored to the nurse's workflow, and the computerized MAR. So I'm going to turn it over to Ben right now to talk about some financials very quickly.
Sure, absolutely. So this is just a little breakdown of what the market looks like as in total. There are 16,000 facilities, as mentioned. Of those 600 of which, 50% of which are controlled by 600 chains. So on average, there's about 13 facilities in each chain. There are 8 chains in particular that are largest in the market that control about 16% of the overall size of the market, 2,644 facilities. Now, if you look at the medication incident cost per year per facility, that's around, based on our research, is around $100,000. All right, just gonna real quick wrap up. So our annual pricing, $30,000 a year. We think that market can bear that. That includes hardware, variable, and other variable costs. We think with a moderate sales team, we can ramp this up very quickly. I'm happy to answer more questions about this since I know we were supposed to have questions right now.
Well, who's paying for this?
This would be paid for by the long-term care facility directly.
Where do they get the money for that?
Well, the average SG&A per facility spend is around $800,000 per year. As mentioned, you know, the current cost per facility is around $100,000 per year for mistaken doses.
There's no government reimbursement, there's no, nobody's helping pay, it's all out of the LTC budget.
Well, there is a small amount that's in the healthcare legislation. There's 70 million in grants that the federal government is giving to long-term care facilities to spend on IT systems. So when we go sell this product, we encourage those facilities to apply for those grants.
When that's gone?
I'm sorry?
When that's gone?
Well, I mean, they would pay for it out of their own budget. So the problem that exists now is it basically costs them money when there are errors like that. So their cost will go down. Potentially their liability insurance will go down for malpractice insurance.
How does it cost them money? Where does the 105 come from?
So there was one study that we looked at that said that there was each incidence of mismedication costs about $8,750 per incident, and for 100, the average facility size is 100 beds.
Yeah, but what is that cost?
Well, that basically includes, you know, additional physicianal care that is required in addition to recovery time, things like that.
So the studies from the Institute of Medicine, that number applies to extended hospital stays. So it doesn't translate exactly to long-term care facilities, but we believe it's close to that, just in terms of like increased care that results from these injuries. Obviously, when there's a death, there could be lawsuits as well.
So it seems like simplicity for the nurse and practitioner is a key issue, and there's been a lot of reports recently about how fragmented the medical records, all that stuff is just lots and lots, and people are spinning up, and there's no large people, and the time to market, and just lots and lots of issues that go into it. So it seems like this is a very point solution, but it seems like for simplicity, you wouldn't want to have a lot of point solutions. You'd want to have one integrated. So what's your value proposition over someone that already has a sales force, already has other complementary technologies? Why this niche focus for compared to someone who I could just buy it on top of what they would do?
So I think that the current issue is that all these EMRs and EHRs that are being developed are really focused on hospitals, and if they are looking at long-term care, they're looking at the big facilities because it's an implementation. It's not necessarily delivered as a service, which we're trying to do to basically lower the cost, and it becomes a subscription fee for these long-term care facilities. So yeah, the market's very crowded. We think we found a niche that no one's really penetrating or no one's really targeting. So when we go in, we obviously interface to the pharmacy system, and if the long-term care facility has other systems, yeah, we would try to interface to them if there's a need to interface to them. But those facilities that we're targeting don't have the capital to buy a McKesson or a Cerner or a big vendor products.
Can you talk a little bit more about your go-to-market strategy? You mentioned the sales force, but is there an opportunity to partner or license it out to other players in the market?
So we still need to investigate some of that, but we do have some ideas. We'd look to partner with possibly some pharmacy systems. A lot of the long-term care facilities outsource their pharmacies, so the pharmacies that actually package drugs are outsourced, so we could look at partnering with them and supplying our product on top of that, which actually reduces our cost because we interface with them once. We've also thought about partnering with some of the drug manufacturers that may barcode those pills to figure out who they actually are selling their drugs to and their medications to, so that our product works for those barcodes. We still have some work to do on that, but we got thought a little bit of that.
What's your competitive advantage? Why are you guys the right ones to do this?
Well, go ahead.
Oh, that's actually you know, quite an answer. Essentially, the competitive advantage is that we provide the service on this instead of a dedicated device. We also do.
The competitive advantage is something someone else couldn't just go copy and do. What about why are you guys the right people to do this, or what do you have that?
Well, we don't have any patents, right, that somebody else could come in and do the product. I worked at a healthcare vendor. I actually worked on a product exactly like this, so I'm very familiar with the actual software. I've got 10 years of development experience in developing healthcare applications, so I think I'm pretty tuned into that market. So I think I could do it, and then basically once we go out and do it and have that product that exists, if somebody else wants to come in and compete with us, and they probably will, that's going to happen. Somebody's going to want to buy us. Somebody's going to decide they want to buy it instead of build it, and that's where we.
So I think that going back to this point about the $105,000 a year cost to the facility, I think that if I was a facility and you guys were pitching to me, I would want more specific data about, lawsuits. What lawsuits happen in this space? How much do average lawsuits cost these facilities? That way I can see the value proposition, because you're basically kind of selling insurance here. You're basically saying, all right, well, you might get sued one day. This system is better for us because you're going to get sued less because you're using the system. That's essentially the value proposition. So I need to hear, as a facility owner, some statistics about this. And maybe you can get like an initial customer lined up and actually use that as a testimonial for other customers down the line. But that's what I need to hear, because that's really the challenge is how do you justify them paying the cost for this system, especially when their budgets are shrinking. And the other thing I was thinking is that on your slides you're showing how you're going to integrate with pharmacies, right? Your technology integrates with pharmacies. Is that really necessary? Because these pharmacy systems are probably completely proprietary, and there's a ton of different pharmacies out there. Why do you need to integrate with pharmacies at all electronically? Why can't the nurses and all of them just input the data into the application?
There are regulatory reasons as to why just some random nurse can't enter a medication. So right now, you either implement a CPOE system, a computerized physician order entry system that the physician enters, or they write the order and a pharmacist has to enter it in. So there are controls around that that prevents basically some data clerk from entering in a medication order, because that then becomes the point of error. And regarding your first point, it's a good point. We obviously have some work to do in terms of when we go out and try to sell this and phrasing our unique selling proposition and trying to figure out what that cost is.
Yeah. Have you talked to any facilities yet and gotten some feedback from them?
We did. We actually went out on Saturday and we talked to a couple different facilities. Since it was Saturday, we basically talked to a nurse and a medication aide, not an administrator. So we looked at it from the context of would they use this system, how would they use it, and basically to the people we talked to, they're very afraid that they're going to commit some error, that they're going to give the wrong drug to a patient. The number that I quoted was actually specific to one facility that we talked to, where a medication aide has 60 patients, and she has to give their drugs to them 3 or 4 times a day.
Just have one last stylistic comment on the presentation. I would suggest jumping into your product right away. I was left wondering for like 5 minutes where this was going. So your actual screenshots of your product are pretty compelling and interesting. So it's just something that I've seen in the past. If you get right into showing your product in a demo, you've got my attention, and then you can back it up later. But I personally wanted to see it more and put a real person's picture on that screenshot as well. It's really personal.
Okay, thanks.
Quick, I think you guys definitely did a lot of market analysis on the numbers and different things like that. I would encourage you to look at innovative ways of maybe partnering with the insurance companies, to your point, but taking a different business model. For example, in our industry, if you can tie it into insurance, a lot of insurance providers have different motivations to differentiate themselves as well as their costs, and they're freaked out right now about all the issues with the government, and they're just jacking up prices for different things. So using that as a triggering point might be a way to be able to turn your business model around and be able to look at the insurance providers as a way to help you get into the market. So,
Okay, thanks.
One last thing is, have you guys thought about your cost of sales? You got the sales force you got to hire to sell into these facilities, but you also said there's a big fragmented market and that there's a ton of little facilities, right? So that's a challenge, right? Because your cost of sales is going to be pretty high. So how is this going to be priced? How much will someone pay for this? And can you afford a sales force to sell into all these fragmented markets?
I can talk about that for a second. We did look at it from the perspective that each of the chain-oriented providers, on average, is going to have around 13 facilities. in which we can implement the service. So we're looking at it from a perspective of, we can have as a goal for each different salesperson to acquire a certain number of chains, and those would expand out to a larger number of facilities. So on average, we think with 5 salespeople, we probably reach installations into 1,000 different or 1,100 plus different facilities.
So you've done the math and projected out, okay, well, here's my cost of sales. Like, you might want to go through that analysis if you haven't already, just to make sure that you can validate that you can actually afford to sell this into those facilities.
Thank you.